Now, if you're dealing with an open fracture, this is a fracture where the bones have broken and also pushed through the skin. So with a standard fracture, you're just dealing with it, mobilizing the limb, putting it in place and transporting it to the emergency services. Whereas with this type of thing, the bones actually come through the skin. So we've got quite a few problems here. First one is bleeding, because the bones are exposed, they've cut the skin. The second one is infection, because this is really an easy way of infection getting into the body, because you've got an exposed, broken bone end. Now, in first aid, we do care about infection, but it's not always our primary thing, because the wound can be treated in hospital later on, but something like this is something that we do need to be aware of. If we were bandaging this, we need to make sure that we don't push on the bone ends. If we push on the bone ends, that's going to cause more bleeding, more pain, more discomfort, and potentially damage other soft tissues, tendons, and things like that. So an injury like this, they're all going to be different. It's very hard on a course like this to say, this is exactly what you do. So think about what you're doing and treat. Now, if this is bleeding really, really badly, you may need to consider putting tourniquet on, because it may be something like this has completely ruptured the artery and you've got blood spurting. So you must put a tourniquet on that. If you do, put the tourniquet on first, because you want to control the bleeding first. This particular one here is a little bit below the elbow, so you could put the first tourniquet on just above the injury site and below the elbow. If that doesn't work, you can always put a second one on higher. When you're treating something like that, you need to be able to put the bandage on. So again, use a trauma dressing. First put on something like WoundClot as a haemostatic agent, because that's going to seal the area very well, promote healing as well. And also that can be easily removed by the surgeons later on. So try and cover it with that, put a bandage on. Now, normally with bandages, we say put them on tight to stop bleeding. However, if you've got bone ends there, that's going to be very, very difficult to do. So you're going to need to look at each individual injury you're looking at and try and treat accordingly. It may be there's just a small bit of bone coming out, or it may be more like this, or it could be a huge cut and you see an entire bone. Key thing is do not attempt ever to push the bones back into the body. Treat as you see and try and immobilize it in that position and control the bleeding as best you can, and then get them to the emergency services.